A deep laceration is present at the proximal aspect of the patient's right cubital fossa. He stops bleeding after medical intervention. Physical exam shows absent sensation in the lateral palm and the palmar surfaces of the first 3.5 fingers. Inability to flex the proximal interphalangeal joints, and inability to pronate the forearm. Additional injury to which of the following structures was most likely responsible for this patient's bleeding? Now, this patient has symptoms of a median nerve injury. How do we know this? Well, the patient has an absent sensation along median nerve distribution. The patient also has inability to flex the proximal interphalangeal joints. Remember that the flexor digitorum superficialis is going to be the muscle that is going to be flexing the PIP joints. And remember that that muscle is going to be innervated by the median nerve. The patient has inability to pronate the forearm. Remember that the pronator teres is going to be the muscle that is going to be pronating the forearm, and the median nerve is going to be innervating that muscle. So our patient has a median nerve damage. And in the cubital fossa, which is going to be the region between the arm and the forearm, there's going to be the median nerve traveling, and adjacent to the median nerve is going to be the brachial artery that is going to be traveling. So that is most likely going to be the cause of the bleeding for this patient. Now here's a picture that might help you out. This is going to be the median nerve, and adjacent to it is going to be the brachial artery. And cubital fossa is going to be this region over here between the forearm and the bicep. And so if there is some sort of damage, for example, over here, you can kind of visualize how the median nerve will be damaged as well as the brachial artery. And so this can lead to bleeding as well as signs of median nerve damage.